Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The World Health Organization is assisting the activation of surveillance structures in neighboring districts and is repurposing its country-based staff to bolster the response and help in containing Ebola. On Thursday, the experts from the organization explained the Sudan strain and responded to some media questions. Dr. Patrick Otim, the health emergency officer, described what they know about the Sudan strain.
The virus is isolated from these two different locations, were given the name Ebola Zaire for the one from the DRC and Ebola Sudan for the one from the southern part of Sudan then. So when we look at these two viruses and try to compare, we will largely look at three areas. One, in terms of the epidemiology, there may be different things that we can use to explain. But when we compare the Ebola Sudan, which is what we have now in Uganda, it is noted that from previous outbreaks, the Ebola Sudan is less transmissible. That is, the ease for it to pass from one person to the next. So it is less transmissible than the Ebola Zaire. For clinicians, usually we want to see the clinical differences. Now, it's always very difficult for these two viruses because when the disease starts, it is non-specific symptoms. But there are certain things that we can be able to see. For instance, for the Ebola Sudan, there is a commonly found chest pain, which was one of the things that was seen in this patient in the first case that was confirmed in Uganda. The chest pain is not very prominent in the Ebola Zaire. The second one is also then in terms of the bleeding manifestations. So you will find that in the Ebola Sudan, which we are dealing with, the redness of the eye, which is conjunctivitis, and the vomiting of the blood, which is hematemesis, is much, much more common.
The disease, according to the experts, has a much lesser mortality rate compared to the Zaire strain.
The mortality with the Ebola Sudan in the previous outbreaks has been seen to be relatively lower. So we have between 40 to 100% case fatality rate compared to 70 to 100% in the Ebola Zaire. However, I would like to add that for both these viruses, if we do not initiate treatment early, sometimes even the Ebola Sudan, which we are saying is much more less in terms of case fatality rate, can cause more deaths.
Supportive treatment can help in managing the infection, but only when the infected person receives medical care in time.
I think we've learned a lot about infections with Ebola viruses over the past decade, including how to improve survival with really good clinical care. And in the past outbreaks, we've seen that survival is highest among people who are younger, people who tend to have lower levels of virus, people who have good organ function, meaning that the infection has not progressed to cause organ injury, and people who present earlier after their symptom onset. And so I'm going to really focus on those last two factors, which I think are critical, because specifically good organ function and presenting early to a treatment center, because good supportive care is available right now. And when started early, it can save lives. And so specifically what I'm referring to is that good supportive care can improve survival in severe viral infections by protecting against organ injury if we're able to start that treatment early. In situations where organ injury has already occurred, supportive care can help us manage the complications of that organ injury. And good supportive care can also prevent further deterioration of that organ injury.
But with the experience from handling previous outbreaks, the experts believe Uganda is in a good place to contain the current wave.
We worked with Uganda just last month to train clinical care providers in Uganda, but also neighboring 4 countries, to be able to be ready to respond to public health events, particularly outbreak like for the Sudan Ebola virus that we're dealing right now. And it was a very comprehensive training with experts from around the globe facilitating. Now, the second thing that we always do is also strategic prepositioning of supplies that is necessary to support the response. And we had prepositioned in Uganda already what we call Ebola kits that are necessary to support establishment of an isolation and care facility in the early stages of an outbreak. And already one of these kits have been deployed to Mubende, and they are supporting in the repurposing of the treatment center that Dr. Chobe had mentioned about, so that we can be able to have effective management of the cases.
The symptoms of Ebola include muscle pain, sore throat, vomiting, bloody diarrhea or urine, bleeding from body openings, high fever, headache, and body weakness. Ebola is spread through direct physical contact with body fluids like blood, saliva, stool, vomit, urine, and the sweat of an infected person or animal. Walter Mwesije, NTV. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store, and distribute essential medicine and medical supplies to all government health facilities.